Can vaccination be used as an entry point for hygiene promotion? Diarrheal disease is the second leading cause of child deaths globally, accountable for about 1.8 million deaths a year. But control strategies include aspects of prevention and treatment. So by prevention, I mean water, sanitation and hygiene interventions, and treatment along the lines of oral rehydration. But there's a new string to the bow now with the introduction of new vaccines for diarrhea. These go specific against pathogens. For example, there's cholera vaccines, typhoid vaccines, and the newly licensed rotavirus vaccines. And WHO, and there's a big global push to introduce rotavirus vaccines, particularly in low-income countries. Now, rotavirus causes a lot of the very severe diarrhea and deaths among very young children. Represents about 30 to 40% of the diarrheal disease burden. So this vaccine would be really a useful additional tool. But there's a danger that it could be seen as a silver bullet and that nothing else needs to be done, and that WASH interventions would go to the wayside. And by WASH I mean the water, sanitation and hygiene promotion. And in itself, WASH has said to have the potential to reduce 88% of the diarrheal disease burden. So it's really important that it's not forgotten, and WHO itself actually says that any vaccine should really be integrated into the already existing interventions, which can work and do work very effectively. Hygiene promotion programs are usually implemented as their own entity, but vaccination campaigns or routine vaccination usually has a very wide reach, able to reach maybe 90 or higher % of the children in a similar age range that you're trying to reach with the hygiene promotion, or the mothers you're trying to reach with hygiene promotion. So it could be potentially very beneficial to try and tack hygiene promotion onto vaccination and use it as an entry point for a wider program that would really aim to be a comprehensive program for reducing diarrheal disease. So that's the reason for trying to explore whether or not you can integrate hygiene promotion. But it's important to first see whether this is acceptable and feasible to the key players in a particular country. And this was the aim of our initial study. It was a scoping mission really to see whether or not key players, and by that I mean key policy makers at national, regional and local level, other program implementers, donors, international NGOs, and also the service providers and recipients, the mothers themselves, would find this to be acceptable and feasible approach. We chose to go to Nepal because it has a high burden of disease, particularly diarrheal disease. It also has a very low coverage of sanitation. Around 50% of the population are open defecators, which means that they don't use the latrine when they go to the toilet. And also because it has a history of implementing vaccination programs and routine vaccination very successfully. We used 3 methods to investigate these questions. Firstly, we wanted to follow the ongoing polio vaccination campaign that was taking place all over Nepal at the time. We did this so that we could understand the logistics, also to be able to speak with the vaccinators themselves, which are female community health volunteers, the pillar of the public health system in Nepal, who are responsible also for a number of other health and hygiene promotion and other interventions in the community, and also to understand operational challenges to do with implementing through a campaign approach. Secondly, we conducted a number of semi-structured interviews with policymakers at national, regional and district level, with program implementers, with donor agencies, and also with national and international non-governmental organisations. This was to really understand their perspective and people who have different degrees of influence on whether or not it would be feasible and how they could see this approach rolling out. And finally, we conducted focus group discussions, firstly with the female community health volunteers to see their perspective on actually doing the hygiene promotion and how they think it would work, as they're the ones currently working within the vaccination system. Secondly, we spoke with mothers to see whether or not they would be willing to offer their time during vaccination for other activities. And thirdly, we spoke with members of an international non-governmental organisation alliance to gain their perspectives as people who would potentially be involved in collaborating to roll out such a programme. So the main thing that we found was that everyone was really positive about this approach, so that was a really good start for us. But the main question that came up was how to do this and aspects of the feasibility of this approach. So the first thing was, if it's going to take place, who is going to be in charge of it? And there was a lot of consensus that it really needs to sit within the government, and a key ministry or department needs to be assigned that will be responsible for it if it's really going to be rolled out effectively and sustainably. The second thing we discussed a lot with all participants was who is going to deliver the hygiene promotion. The obvious choice seemed to be the female community health workers, but as they're volunteers, there's a danger that we could be overburdening them by asking them to do more and more things that are no longer a voluntary status. And we discussed other options, and a number of different groups and types of people were also mentioned, and also really involving people at the really local village level if we want to have a sustainable program. This was one of the key things actually, was the fact that we're not talking about hygiene promotion one-off at vaccination, but more this would be an entry point for a larger program. So we also discussed what is the ideal entry point. Should it be routine or vaccination campaign? Now, routine vaccination is the normal schedule of vaccines that a child would receive at a particular age, and a campaign setting is a bit different. This would be a national day, for example, for polio vaccination, when all children of a certain age would be vaccinated en masse. So, of course, in a campaign setting, you can reach a large number of people at the same time. But because it's an oral vaccine, as rotavirus would be, the same as polio, it's a danger because the mother doesn't bring the child. She often would send an older sibling or a grandparent alongside. So you're not necessarily reaching your target group if you want to indeed reach mothers with your hygiene promotion. In a routine setting, the mother does come along, but of course, because it's routine at a certain age for the child at which they would receive their vaccination, you get less mothers at a time. So we discussed a lot of these different issues. One of the key things that needs to happen next is that any hygiene promotion intervention that's developed would need to be piloted. Many of the participants we spoke with were concerned that Nepal's a very diverse country, geographically, also culturally, different religions, different levels and degrees of sanitation coverage and practice of different behaviours. So it would be really important to pilot this approach in more than one location in Nepal. Well, the obvious first next step is to pilot this approach while the iron's still hot, as you might say. A number of NGOs in Nepal were keen to take on responsibility of piloting, so that will be the first next step. Also, we need to have a conversation on a global level about whether this would be a relevant approach for other countries as well before rotavirus vaccine is introduced. And I think it's very relevant, and this is a key conversation to be discussing integration of hygiene promotion into vaccination, and something that isn't usually done, and so an exciting opportunity to really be developing comprehensive programs to tackle diarrheal diseases and make sure we really are getting the maximum benefit that we can from all the interventions that we have.